over whether or not they'll cover for the costs I went through. I was spit out. I've not raised the issue publicly with people because I knew once I did, being a United States Senator, it would probably be solved in a moment's notice. But I thought it was instructive that a computer would spit me out because I'm turned 65, now qualify for Medicare, despite having paid premiums over the years, that Medicare ought to pay for my coverage, not the coverage provided by the insurance company that I've contributed to significantly over many, many years. But one example, and again it goes on with all of us here to be in those debates as we've all gone through. The point I want to make here is that insurance companies aren't evil despite a lot of the rhetoric associated with the debates. The point is the way that our system has evolved over the years. Insurance, as we know it, really doesn't allow you to be sure of anything, and for too long it has not been available to millions of Americans who need it the most. And that is at the heart of why Ted Kennedy made health care the cause of his public life, and why I've said that this vote is maybe the most important one that I will have ever cast in my public career. Another Teddy, of course, I mentioned earlier, Teddy Roosevelt, was the first of our American presidents to argue that health security should be an American priority. And over the course of time, throughout the past 99 years, almost without exception, every single chief executive of our country, regardless of political affiliation, has argued for health care security in our nation, including various ideas along the way. FDR spoke about the 4 freedoms that he considered essential in our society: freedom of religion, freedom of speech, freedom from want, and freedom from fear. And it was this last point that I talked about during this debate. He meant it as a freedom from the fear of world war. In those days, that those of us in a certain age thought about a lot in our elementary schools growing up in the 1950s. But I mean the freedom from the sort of quiet fear that can sneak up on you after you've gone to bed late at night. It's a fear felt by a mother or father listening to their children cough in the room next door, praying that his or her fever will go down because there's no money to take them to that doctor, and fearful about showing up in an emergency room. It's the fear felt by a worker whose job is in jeopardy, knowing that without the job, as important a loss as that may be, that pre-existing condition will prevent him or her from finding the insurance, or again, a loved one in their family, afflicted by an illness or an injury, would lack the ability to provide for them. It's the fear felt by a senior citizen whose doctors just prescribed yet another set of medications, even though he or she has to cut their prescriptions in half to afford the ones they already are taking. Those fears are going away of the old, along with the old hide-under-your-desk drills that we went through, and the fear of conflict back in the 1950s, in large measure due to this legislation. Now, we have a long way to go. Let me quickly add here that we drafted the legislation, we passed it. But this is, as someone described it to me, more of a commencement exercise in many ways than a conclusion in many ways. We have a lot of work to do, as future Congresses will, in fooling and working with this legislation in order to produce the desired results we all seek. But we can never go back again, and that was the critical importance, in my view, of these votes that were cast. For the record, of course, there's a lot of things we now know about this legislation, despite the gaps that existed during the deliberations on this that led to a lot of fear that we saw in our country. For the record, there are no death panels, of course, despite what many talked about during the so-called town hall meetings of last August. In fact, I recall in the town hall meetings, it was during the town hall meeting month that I was going through my own surgery and recuperation. But in the midst of all of that, Teddy lost his life, and I was asked to speak at his memorial service at the Kennedy Library in Boston, John. And when I got up, I told the story, absolutely a true story, when I'm in the recovery room at Sloan Kettering in New York that day of recovering from the surgery. A nurse, as I was coming to, came up and said, "You have a very important phone call." And I said, "Well, who in the Lord's name would be calling me in a recovery room?" And she put the phone up to my ear, and that booming voice of our former dear friend from Massachusetts said, "You may be the only American," he said, "who would rather go through prostate surgery than do a town hall meeting." That was old Teddy, right at the moment here, a week before his death, was still having a good time at my expense and going through all of that. At any rate, there is no armada also of IRS agents that are going to be coming to collect your Obamacare payments, despite what some have suggested. And if you're hoping for a socialist takeover of America, the American economy, well, you're going to be terribly disappointed by all of this. But let me talk to you about 2 or 3 things that this bill does do, and important. First, there's a wide array of benefits and protections that go into effect this year which I know many of you may have read about, but are important to, I think, note once again. Tens of thousands of uninsured Americans with pre-existing conditions and parents of children with pre-existing conditions will finally be able to get the insurance coverage that they need. Young adults, and this happens more frequently today because of the economy we're in, will stay on their parents' policies until they turn 27, or can stay on there until they turn 27. Insurance companies can no longer drop people when they get sick or put limits on the amount of care that you can get over your lifetime. That goes into effect this year. And small businesses, owners, who for years have complained about the disparity that exists in the tax breaks they get as opposed to larger corporations when it comes to health care costs, are going to take advantage, or will be able to take advantage, of tax credits this year to cover the health care of their employees. And senior citizens will begin that process of filling that infamous donut hole they've talked about on prescription drugs, with as much as $250 this year to pay for prescriptions. These are the provisions that begin to take effect immediately. And if that was all there was to this bill, I might suggest to you that in itself wouldn't have been a bad piece of legislation to deal with those issues. But many of the Americans who live with health insecurity don't fall under any of these categories. They have insurance, they're not sick, they're not small businesses, their children are grown or not yet seniors. They're just regular people who live with the fear that although things are working for them right now, there's nothing to stop the bottom from falling out if they lose their jobs or if they're diagnosed with cancer. And there's nothing to help them keep the coverage if they decide to move or start a small business for that matter. And that's why this fear is so pernicious. It doesn't just affect the people in those horror stories that we've all read about and heard about. It affects every single one of us who hears them and thinks that there but for the grace of God go I. So the second thing this legislation does is to change our system of insurance so that the power doesn't rest with the insurance industry. And by the way, it doesn't rest with the American government either. It rests where it should have always rested, in the hands of the people themselves. They and their physicians, their health care providers. The health insurance exchanges that will be set up over the next few years will provide individuals and small businesses with an easy-to-understand opportunity to pick the health care plan that best suits them at whatever stage of life they are in. If you're making the decision for yourself, your family, or your employees, one option you'll have is to keep exactly the plan and the doctors that you have today. Or you can access plain English information that'll empower you to compare different plans, apples to apples, so that you can make a smart choice for yourself and your family. And again, there won't be any bad apples in that barrel because of the consumer protections that will be in place. Third, the thing the bill does is to address costs for families and for small businesses and for the federal government. For families and small businesses, these tax credits and direct assistance support make better insurance more affordable for people. And while the new law, which is very controversial, does insist that everyone has the responsibility to get insurance, it gives the government the responsibility to make sure that those individuals can actually pay for it. The mere fact that the insurance industry will no longer contain a hidden tax on the average of $1,100 a year for most individuals and families will be an enormous burden lifted, not just for families and businesses, but of course for the federal government as well. And our bill attacks all sorts of waste and fraud and inefficiencies in our system, in areas of the bill that were never the subject of any controversy or discussion and debate. The prevention areas that take up almost 50% of the bill were ones where there was great commonality and interest in achieving. That's how the Congressional Budget Office, of course, can conclude that this legislation will bring down our deficit by more than $100 billion over the first decade and over $1 trillion in the decade after that. It's not the end of our work, as I said a moment ago, but we have to do what we have to do to make our health insurance system as good as the doctors and nurses who provide that care. But it is an incredible beginning and long awaited and long overdue. The benefits of this legislation will be felt by generations of Americans, but I hope the experience of passing it will be remembered by future generations of legislators as well. If this vote was the vote of my career, it is perhaps the understatement of my career to say that the path to that vote wasn't easy at all. The bill inspired controversy, misinformation, and even confusion, and that was just among my colleagues in the Congress. At the end of the day, the Congress actually rose to the challenge and accomplished this legislative goal. Americans may have disagreed about the particulars. I know they did of the bill, but they shared the need for action. There was no debate about that. And they shared the doubt that our political system was capable of the kind of comprehensive solution the problem demanded. I happen to thank Barack Obama. Put aside whatever your politics may be in this audience today. I've always admired American presidents that were willing to take on large issues. We've been through so many administrations over the years where the decision was to survive, to make it through that next election and have those 2 terms, if you can, in office. But very few American presidents are willing to take on the large set of issues. Pat Moynihan once told me, a wonderful colleague that Bennett and I served with, that each American president gets about 20, maybe 22 months to actually be president on large issues. That after that, it's the midterm elections, you're trying to survive, that get reelected if you can, and at the end of the 4 years, and then you're a lame duck for 4 years. So you get these windows that open up from January 20th, the day you were sworn in, until just prior to those midterm elections to accomplish anything of major significance. And so I admire immensely the fact that this president decided to take on this issue. You'll all recall, and history will certainly note it, that during that process there were those who advocated he give it up, move on to the issues, put it aside. No one will really fault you too much. Everyone else has failed at this. Why should you continue to bother? Get back to the easier ground, the safer ground politically, and put this issue aside. I admire him for not quitting. I admire Nancy Pelosi for not quitting as well, and Harry Reid. And I know they took a lot of criticism from people for various reasons along the way. But the fact that they stayed with this and didn't quit on the subject matter. In fact, I happen to believe that the election of Scott Brown in Massachusetts probably helped in many ways for Democrats to realize that they couldn't just rely on 60 votes to get the job done. They had to roll up their sleeves and be creative and imaginative on how to sit down and work together to accomplish the result. In fact, I think the worst number, in many ways I wish we'd had 65 or 55 votes in the Senate. Either way, it might have been easier. And the Republicans would have had either 35 or 45, in which I suggest we might have had more bipartisanship had that been the case. But 60-40 were 2 dreadful numbers. Mitch McConnell then had to hold on to that 40. Harry Reid had to get that 60. And therefore, it became a game of numbers in a sense, rather than not having those kind of concrete numbers that are the Senate rules mandate in terms of passing anything, made it more difficult. But the fact is, we did this. We set this in motion. And even though there are various provisions of this legislation which I know continue to raise concerns with many people in this country, the fact is we are now on a path, I hope, as I'm sure all of you do as well, that freedom from fear that Franklin Roosevelt talked about in his inaugural address of 1941 will be a fear that we can minimize at least. It doesn't mean it's over with any more than that fear I felt when I got that call in the wee hours of Saturday morning about a brother, or a month ago, the decision my wife and I made to rush my 5-year-old up to the Children's Hospital here with a dehydration because of a stomach flu, and you're in those rooms worrying whether or not they're going to be all right. But also being in that emergency room on that 11 to 12 o'clock on that Saturday night and see it filled with people, not the victims of injuries or car accidents, but people showing up because their kids were seeing their primary care physician, the emergency room doctor, because they don't have the resources, don't have the insurance, don't have the coverage, the deductibles are too high, and that's where they show up for that health care. And that now can begin to change. And for all of us in this country, that is a significant, monumental achievement. And I thank you, John, for inviting me by to share some thoughts. Appreciate being here. Thank you all very much.
Thank you.
Any questions?
Thank you very much, Senator. Are there any questions?
Just to pick on a senator. Doesn't get better than this.
Yes.
Hey, how are you?
Chris, that was a wonderful...
So nice to talk about something other than financial reform, too. I'll stay all afternoon if you'd like.
Chris, that was a wonderful speech. My first question is, will that be available in transcript? I want to read it again and enjoy it.
Yeah, we'll make that available, John. That's
good.
Job. We're gonna make that available.
Let me ask you, why do you think the Republicans were so dug in on this so hard and placed so much of their goodwill going forward on the table when they could have lost and in the end they did lose?
Well, obviously a better question for John Boehner and for Mitch McConnell than for me, and so it's a pure speculation. First of all, I don't think it's my own sense, and again, for those who served in the institution, in the House or the Senate. At first, I don't think it was quite as monolithic as the votes would indicate. I think there were an awful lot of people who went along with the strategy, more of a tactical approach, I think, than anything else, that very much wanted to be a part of this. You don't get elected to these institutions to want to just say no to things. I mean, it's not why people run, despite the fact some may do that, but the overwhelming majority want to come, and when they leave, they'd like to think that at some point someone's going to stand up and talk about what you did in order to help the country move forward and trying to achieve that more perfect union that our founders described so many years ago. So I'm a little mystified in a sense as to why that strategy or those tactics prevailed. Now, obviously there were legitimate concerns and debate about parts, which I'm not suggesting was otherwise. But normally there's the process that works that has really fallen apart. Now, I'm not as pessimistic. I mean, nothing bothers me more than to watch people leaving Congress and sitting there and just ripping it apart as they walk out the door. I feel quite the opposite. This is not a trajectory, either one way or the other, with the Senate or the Congress. I'd make a case, and historians in the room, and Jim and John are certainly qualified, and others here as well. I would argue that maybe the worst decade for the United States Senate, the 20th century, might have been the 1950s. It was the era of McCarthy hearings. It was dreadful. A lot of finger-pointing going on, a lot of accusations. People's careers were ruined. Their lives were ruined. You could also make a case to you that maybe the first half, if not the entire decade of the 60s, might have been one of the great decades of the 20th century. Certainly, John, your presence there with Title I education, Medicare, the Civil Rights Act, the Voting Rights Act, an incredible, all events, we understand why they occurred. But my point being is that went from one decade to the next, where things weren't working well at all. The institution was in deep trouble. And within a decade, the Senate was producing remarkable results from which our country has benefited tremendously. So I get upset when I hear people talk about the trajectory of the institution as if it were on a permanent path, either up or down. It really more is like a wave. These things move back and forth. It all depends upon the comedy. The unwritten rules that the founders never incorporated in the Constitution or in the rules of the institution. And getting back to that. I don't know how you quite do this, and it's difficult today, but it's those personal relationships that really cause the place to work, and the absence of which cause it not to work. And it's gotten harder today, I think, in both the House and the Senate. And there are a lot of reasons for it. The fact that people have such great access today to return to their districts and states. So it's not uncommon today when my colleagues here that we arrived together in that January day of 1975, most of us came to stay in town or were here, went back on Fridays, stayed here a lot of weekends. Today, people arrive on Monday night or Tuesday morning and leave by Thursday night or Friday morning. You're here on committee assignments. You don't really get to know each other terribly well. And as a result, your only encounter with each other is in a committee hearing or when a vote occurs. And not the kind of understanding that happens because you spent time and appreciate that person who you thought you never could agree with, you found common interest. People have often asked me why Teddy was so successful legislatively. And it was because he'd oftentimes, I used to tease him, the Republican leadership over the years would try to find the meanest, roughest guy they could send to become the ranking minority member of that Health Committee. And they'd send over the toughest guy. And then, of course, within 6 months, they'd feel, why is this tough guy working with Kennedy on things? And of course, it was not anything magical. Teddy'd sit down. He'd always have a dinner in January, February, early February with the new members. And that committee would sit down. And the first question he'd ask them, he'd say, tell me what you're interested in. And someone grudgingly, well, I'm interested in actually, well, let's do that together. And of course, then they'd be off, and because you've just trapped yourself by agreeing to something you cared about doing. And that was Teddy's agenda for the Congress. And of course, they'd be coming out with bills right and left. So, and it's not sounds silly, but it's really what works. It's what Bennett did over the years, and his Energy Committee and others. You just sat down and find out where the tipping points were, what the interest was, and you worked on those issues together. And I think that it's broken down in a sense. But I think in a sense it may have passed over to, I'm going to be in the midst of this financial reform debate in the coming days, and while letters are being signed and threats are being suggested, I'm pretty confident that we're going to end up with a bipartisan bill on this stuff, despite maybe the wishes of some and the negotiating position of others. Sorry about the length of the answer.
Any more questions?
Oh, God, I can't believe this. This is wonderful, I tell you. Yeah, Bob.
Would you make a couple of comments on campaign finance reform?
Oh, geez. I tell you, no, this has been the plague of all of us. Campaign finance reform. Of course, after the decision by the court next door here. I went over. I always say it's the best conversation in Washington. I look at the Supreme Court agenda, and I will go over quite frequently and sit over there, John, to watch the debates. As someone once described it as the best conversation in Washington on some of these issues. Went over for that debate, Bob, on the corporate contributions. Again, my worry about this is that it's so shrinking the potential pool of people that will run for public office. I mean, we all know the stories of our nation going back where you had to be a white male that owned property to let alone run for office to vote. And obviously all of those laws have long since disappeared, but we're getting back to a de facto, if not de jure, shrinking of the pool of people who can even think about doing this. And deeply troubling to me that you now either have to have personal wealth. Parties now seek out self-funders if we can, people who can write their own checks to do this. And again, no one should be precluded in a sense because they're affluent from seeking public office. But when the scales are so tipped and imbalanced in a way that we end up with the predictable results, if I could change any one thing, though, campaign finance reform would probably be my second choice. But if I could change any one thing, it was may have been Al Hunt, or I'm trying, who asked me the question one day. They said, "I'm going to give you, I'll give you the power to change one law in the United States. What one law would you change if you could today?" And the law I would change is on reapportionment. On anything else. And that, of course, is we're the only institution that doesn't reapportion itself, the House, I'm speaking of, obviously. And the fact that we only have about 40 or 45, I think I'm correct in this, someone can, John, you'd know, really seats in play out of the 435 House seats, that they've now been, the lines have been drawn in such a way that you have, the only fear you have politically is that someone to the right of you, if you're a Republican, or to the left of you as a Democrat, in a primary. But beyond that, pretty much you can escape that. So it has a tendency to push out the parameters of the institution, making it harder and harder to find those that often spoken of middle ground on issues. And I really worry about that. So if I could change one thing, it would be how congressional district lines are drawn. Quick second would be on the financing. But until we change that, I worry in the sense that the whole process, the natural forces are driving the institution and members farther apart from each other rather than bringing people closer together, where you don't have to listen any longer. If you don't have to listen to minority voices in your congressional district, in your state, that's dangerous, in my view. You may not agree with them, but you should listen. And if you no longer have to listen at all, but you're listening to the sound of one drum, it is a little intimidating and frightening to me. So campaign finance reform is important, but getting back to some sensibility on drawing congressional lines is, to me, the single most important reform we need to figure out how to change.